Hello, and welcome to the webinar, The 9 Key Points to Know Before Supporting Clients with Fertility Awareness. So this webinar can be useful for you if you are a practitioner that is working with women, if you wish to understand how charting could help a couple in their fertility journey, and if you would like to deepen how you could blend this new tool of fertility awareness in your practice easily and to really help your clients. Who am I? I'm Cecilia Gautier. I live in Italy and I work mainly in Europe, in Italy and France. I'm a certified fertility awareness instructor in Italy of the symptothermal method of Gautier. I specialize in restorative reproductive medicine and holistic fertility support, blending these tools with the Arvigo techniques of Maya abdominal therapy. I also teach different courses for midwives and holistic practitioners, both in France, Italy, and online. So I designed this webinar really to give you an overview of all the things that we should know as practitioners that are supporting fertility clients and on how to blend natural support with the observation of menstrual cycles. So the first important point is that a fertility journey is always a couple's process. So fertility is of the couple. Even when there is a diagnosis of subfertility or infertility that is given to the man or the woman, it is always a couple's process, not only psychologically, because they are in this together, in this journey, and also they are looking for a child that they want to welcome together, but also because the truth is, even when there is a diagnosis that the problem is of one of the two, both the level of fertilities of the man and the woman have an effect on the couple's fertility. So if you increase the fertility of both the man and the woman, then it really increases the chances for them to be able to conceive and also to continue the pregnancy in a healthy way. Here we have the moment of conception, and we see that we need a healthy ovum and healthy sperm that meet, and this meeting can be prepared in the preconception months preceding the pregnancy. So that's very important that the couple prepares together. So what we said about the diagnosis, sometimes it can be a blessing, but it can also be a curse. So in my experience, what I could see is that there are some couples that have tried to conceive for 1, 2, or many years, like in my experience up to 10 years, the couples that I saw. And basically the doctors told them that everything was fine. But if you try to conceive for many years without success, then it's not true that everything is fine. There must be something that is not going in the correct way. And in this case, observing the menstrual cycle in detail really gives you a lot of clues. It really allows to understand what's going on in the body, and it can help the doctors to find out something that they did not see before and that they were not able to diagnose. So fertility awareness can be a first step to be able to have a diagnosis that psychologically really helps the couple to understand what's going on, and also medically can help the doctors that are supporting them. A diagnosis can also be a curse in the instance when the doctor gives the big diagnosis of something that cannot be cured or that interferes heavily with conception or pregnancy. I remember another of my clients that had one tube blocked, and the gynecologist told her that she was scientifically not able to conceive at all. And this was not true. She had one tube blocked, but the other tube was free. So it is true that it can interfere with her fertility, that she could have more difficulties to become pregnant, but that does not mean that she could not conceive at all. So here, how the diagnosis is said, how the client takes it, well, the patient of the doctor in this case, it really has a big impact on the fertility journey and the steps that then the couple decides to take. The infertility diagnosis is it is really an important topic for the couple and for the practitioners that are following them. And there is a study that was made on that was run with more than 1,000 couples that were previously diagnosed with infertility and that were trying to conceive in average for 5.5 years. 47.2% of them were diagnosed with unexplained infertility, so they diagnosed that they could not conceive but they didn't know why, and 11.6% had an unexplained recurrent miscarriage, so they were repeatedly miscarrying but the doctors didn't know the reason. Then all these couples were followed with fertility awareness instructors that taught them to read their menstrual cycles, and these cycles were then studied by the doctors specialized in restorative reproductive medicine that were following the couples. And what they found, with the observation only of cycles and then specific medical analysis done with the cycle observation, they found that only 0.5% of these couples had really unexplained infertility. So that means that all these 47% that did not have a diagnosis were able to understand why they could not conceive. And for the recurrent miscarriage, only 0.2% they could not explain why they had this recurrent miscarriage. But the rest of the 11.4% of couples were able also to have an understanding. So this was specifically with NAPRO technology, which is a branch of fertility awareness really specialized on the medical tools and treatments. So how do we observe the cycles? Well, we observe the bleeding patterns, the mucus patterns, and the temperature patterns. And putting all of these in a chart in a comprehensive way and in a very precise way really helps us to understand what's going on. So the bleeding can really help us understand what is going on inside of the uterus and the endometrium. It can help us also to understand what if there is a problem in the cervix or also in the hormonal levels. The mucus as well really helps us to understand what is going on in the ovaries and the cervix with the hormonal levels as well, estrogens and progesterone that impact the quality of the cervical mucus. And the temperature patterns gives us an indication on the ovulation, if it occurred, if it did not occur, and on the levels of the luteal phase. Here we have an example of the cervical mucus. This is called a low quality cervical mucus. We see it is a little bit elastic but quite thick and white, not transparent. And we have here a high quality cervical mucus which is much more elastic, transparent and clear. And these are two types that we can normally observe during a menstrual cycle, but it's not only important to know which quality is our cervical mucus, but also when it happens, how many days it happens, and really the pattern throughout the month. So many women, they do learn how to chart the cervical mucus, but they do not understand all of the subtleties that we can read only with that information. So a trained practitioner can really receive a wealth of information through that only if the woman understands how to correctly observe and register it. So for example, with only this indicator, what can we see? We can see what is the most fertile time for the couple to try to conceive. We can see what are the levels of estrogen. We can see the duration of the post-ovulatory phase, which is extremely important for conception and implantation. We can see if there are possible underlying infections to be researched and treated by the doctors. And we can see if there are potential problems also to be further researched and treated by the medical doctors with the cervix, with the quality of ovulation, with the functioning of the ovaries, with the connection between the pituitary gland and the ovaries, with the hormonal levels of the menstrual cycle, and with the capacity of survival of the sperm. Only with this indicator, and then if we mix the cervical mucus observation with the bleeding patterns observation and the temperature observation, then the information we get is even higher. But then all of this cycle pattern that we observe should be taken into account in the fertility support, because we observe what's going on in the cycle, but also we can adapt our advice and our natural support as holistic practitioners to the different phases of the menstrual cycle. So, depending on what we observe, we can really give different and tailored advice to the woman. We should do it, in my opinion, as holistic practitioners, and also the doctors should also do it in their medical advice, because every woman can have a very specific pattern in her cycle and need different things depending on the phase of her life and depending on the different hormonal levels that we read. So another thing that is extremely important when we observe a menstrual cycle is that we cannot interpret a chart if we don't know if the signs of fertility were observed and registered correctly. So this is extremely important, because sometimes I see women in a first consultation that come with different charts, because on the phone I ask them if they already know about charting, and they say, yes, I'm tracking my BBT, my basal body temperature. And I said, okay, come with your chart. They come, and when I start asking them how they charted, how they registered these symptoms, they are unreadable, because they just read some advice on the internet. They didn't do it with the accuracy that was needed, and then it is very difficult to see if we can base our readings on what was observed. So we need to start from scratch. We just trash these old charts and they start to chart again with the correct, precise indications, and then we start to read a lot of things and they start to gain confidence. Because charting without knowing exactly what you should read and how to read what you observe is extremely stressful. And that's why a lot of doctors don't advise it, because they say it rises the stress levels of the woman. And it does. I could observe it many times. But the thing is that when a woman and a couple is followed by a trained practitioner that really gives clear indications and that is capable of explaining what we can read in the charts, then the stress levels really come down, because they understand what's going on, they understand that they can be in control of something, and psychologically it really motivates the couple and it really helps them to go forward, because they start having a plan. It's like lighting a light in the room, and instead of walking in the dark, they start to walk in the sunlight. That's a big difference. So that's why fertility awareness education is a professional skill and competence. So there are many certified fertility awareness instructors around the world. Generally, the training of a certified fertility awareness instructors is of 2 years, sometimes shorter, sometimes longer, depending on the schools. but it is a professional skill that should be learned, and that is really helpful to have this strong scientific and relational basis in order to be able to bring that education to the couples in such a difficult situation also as fertility challenges. So, to round up a bit what we have said, the menstrual cycle is very complex and fascinating, but knowing it empowers women, couples, and the practitioners who follow them. Really, it gives tremendous indications. Many fertility awareness methods are available, and I'm grateful for this because not everybody is the same. We all have many different personalities, ways of life, and these different tools can adapt each to their needs. So, for example, there are some methods that only rely on cervical mucus observations, like this chart. It is a Billings chart that rely only on mucus observation, whereas I choose a method that also observes temperature, because for my personality, I prefer to have more indicators. So that's good for me, and that's good for the couples I follow. But some other couples and some other practitioners prefer to keep it more simple, and I can still have really a wealth of information with that. So to give you an overview of the different methods that are available, well, I'm not going to list all of them, but the main ones. We have the ones that mainly rely on cervical mucus only observation, and we have the Billings ovulation methods, and we have the Creighton's model system. Then we have the symptothermal methods that rely on cervical mucus and basal body temperature, and then also optionally on the self-observation of the cervix. And then we have the Marquette method that relies on cervical mucus observation and on LH sticks that check the urinary metabolites. The symptothermal method, which is the one that I use, is a complete tool that can help holistic practitioners to support their fertility clients. So here we see a chart. We can see how the mucus changes, how the temperature changes, and in this chart we don't see it, but often I ask the clients to really write a lot of details, and this gives more information about what's going on. For example, a premenstrual syndrome, some spotting, the quality of the menstrual blood, and we can write all of this. So the symptothermal method that I teach is from the school INER in Europe. It was created by Dr. Rother, which was an Austrian doctor, and it was one of the founding fathers of the double check method of birth control. So a method that did not include only one symptom of fertility observation, but at least two of them. It is also known, this method, as Sensiplan. It is another school, but that teaches basically the same methods. And it is the methods that I teach in my hands-on charting course. So this course I tailored specifically for holistic practitioners that want to deepen their knowledge of fertility awareness and how to use it to support fertility clients. So it is a 4 months online course. It is really designed to provide the fundamental knowledge on natural fertility support, and it helps the practitioners to include a precise analysis of the menstrual cycle in their practice of fertility support. It is reserved to the practitioners that are working with women, so it is not designed for individual women that can instead ask for private consultations. And it has quite a full program during the overall of the 4 months. So the charting basics is how to observe and register the cycle and the symptoms of fertility in the correct way. A very deep description of the anatomy and physiology of the menstrual cycle and of the conception and beginning of pregnancy process. There is another chapter on progesterone and the temperature and the cervix and production of cervical mucus. Then there is the art of interpreting charts. So how do we interpret a chart that is in front of us? When a woman comes with the chart, so we don't look puzzled, and instead we can look very pleased to be able to decipher a new chart and a new cycle for these clients. So there is a standard chart interpretation, and then all the variation that can happen, that can happen in bleeding, mucus, and temperature patterns, and how can this impact the fertility of our clients. Then there is the fertility support with charting, how to support our clients with this chart. So the time frame, how to help the client discuss with their doctor with what we can read in the chart, the networking for fertility support and charting. For example, the networks of fertility awareness practitioners and instructors is quite widespread in the world, and there are very good resources and good people to network with for the support of our clients. And we will see also, last but not least, the case studies. So we will see in practice different cases of clients that I have followed with their charts, and how did the process go on, how was the natural support and medical support handled, and how we can read all of this progression in the charts of these clients. I must say that's quite an amazing part. There is a special bonus for the Advigo practitioners that want to participate in the course, because we can dive specifically on how to apply the ATMAT tools with the charts. So how to adapt our treatments, our self-care advice, also for the vaginal steams and the castor oil pack instructions. So if you wish to participate in this course, there are some sessions per year with a very limited number of participants for each session, because I really want to have the best of support for each group and really have the time to dive into all the questions and make sure that the moment of learning is the best for you as possible. So the groups are kept small, and we have every 2 weeks some online group meetings, and all of the content is transferred to you by video and PDFs that you can study at home. So I hope to see you soon in a group, and in any case, I wish you a very good journey in your work supporting fertility clients and diving into fertility awareness instruments in the methods that you do prefer and have more affinity with. Have a nice day. Bye bye.